The most common symptom of having liver failure is having no signs or symptoms whatsoever. Anybody listening, if you know somebody with man boobs, they almost certainly have fatty liver disease.
Dr. Ken Berry is a world-leading expert, international speaker, and a best-selling author.
He's on a mission to fix your liver and your body, and it starts with what you eat.
If you've been told you have insulin resistance, if you have hypertension, if you're overweight or obese, you probably have fatty liver. Fatty liver can cause heart disease. If the liver is scarred enough, you can cause your heart to fail because it just can't pump the blood through the liver. And it's all completely reversible, completely curable if you catch it just at the fatty liver stage. There is no liver cleanse that's going to fix your fatty liver. And indeed, many of the liver cleanses out there will make your fatty liver worse. You got to leave your liver alone so that it can heal. You've got to stop assaulting it, stop insulting it, stop damaging it with the slow poison, which is a high sugar diet. Whether that sugar is coming from added sugar or whether it's coming from fruit juice and eating lots of fruits and lots of honey. Honey is higher in fructose than almost any other food on planet Earth. 99% of turmeric is you poop it out. You don't even absorb it. In this case, fatty liver, the way you reverse it is by removing things.
What about things like bacon and butter? Is that going to help with fatty liver?
If you stop eating the honey buns and the Doritos and you start eating more bacon and butter, you're going to reverse your fatty liver.
This episode features Dr. Ken Berry, and he's going to discuss a problem that over 50% of you have, but don't even know, and that is fatty liver disease. And shockingly, no pill and no supplement will save you, but one simple change to your diet will fix it completely. So if you're learning from and enjoying these free episodes, please hit the subscribe button because we know that food is medicine. And by subscribing, you can help share the message to millions more people that need to hear it. And now for the episode with Dr. Ken Berry. Dr. Berry, welcome.
Thank you so much, Rena. Good to be back with you.
When people think about chronic disease, what is going to kill them? They're going to think about heart attacks and strokes, but most people are not going to think about their liver. And if you have fat in your liver, which is also called fatty liver disease, you can end up dying. You might not even feel it. You might not even see it until it's too late. So in this episode, Dr. Berry is going to share his no-nonsense approach and explain very simply what is fatty liver disease, the signs and symptoms that you need to know, and why bacon and butter could be the answer to heal your liver. So Dr. Berry, my first question. If someone has just clicked on this video and they're thinking, I have no idea what fatty liver disease is, why should they care?
Well, they should care because it can lead to multiple other complications, including death. Initially, 20 years ago, when I was early in my medical practice, non-alcoholic fatty liver disease was very, very rare. We would see that very seldom. Alcohol abuse back then was by far the most common cause of fatty liver. And that's why non-alcoholic fatty liver disease was given that name initially, because it was like, well, this guy, I know he's not an alcoholic, but he still has fatty liver. And so that's why it has kind of a negative name, non-alcoholic. And so we now call it metabolic associated fatty liver disease. That's the name that's slowly but surely being adopted for this, because that's exactly what it is. And so I think every medical condition should have the solution in the name. And so there's something wrong with your metabolism. And it's not that your metabolism is broken. It's that the food that you're eating is overwhelming your metabolism with too many carbohydrates. And so the problem with fatty liver disease, metabolic associated or non-alcoholic, is that the most common symptom that people will notice is not having any symptoms whatsoever. And so non-alcoholic or metabolic fatty liver disease is so tightly associated with the following things that we can say almost definitively, if you have one of these things, then you're at much higher risk of fatty liver disease and you need to get that checked out. If you have prediabetes or type 2 diabetes or type 1 and you're eating lots of carbohydrates, you probably have fatty liver disease. If you have hypertension, if you're overweight or obese, you probably have fatty liver disease. Definitely, if you're drinking lots of alcohol, that can still cause fatty liver, even though that's no longer the most common cause. And so if you have metabolic syndrome, if you have, if you've been told you have insulin resistance, which typically means hyperinsulinemia, then you probably have metabolic associated fatty liver disease. Now, how do you get it diagnosed? How do you know? You go to your doctor and you ask your doctor to check a complete metabolic panel, which is going to include the two tests, AST and ALT. And you're also going to ask your doctor for a GGT. These three tests, if any one of them is elevated, then that increases the chances that you have fatty liver disease. Then the next thing you're going to do is say, okay, I have this elevated level. Let's check an abdominal ultrasound if you're not too overweight. But if you qualify as obese, then your doctor's probably going to have to do a CAT scan or an MRI to be able to see the liver. And so when you get that scan back, it's very obvious that you have fatty streaks in your liver. And there you go. You have the diagnosis of fatty liver disease. So it's actually, I like it when people get this diagnosis because it's so easy to fix it.
Absolutely. I think people are probably going to think, well, if I'm just sitting here thinking, do I have fatty liver? They can probably get that test done. How common is it that people are going to get fatty liver disease worldwide?
It's so common, Rena, that many radiologists who are the doctors who specialize in reading CAT scans and MRIs and ultrasounds, that they often forget to comment about it because it's so ubiquitous. This is also the case for fatty pancreas, which is also a real thing that's greatly underreported and underdiagnosed, very dangerous condition. But a lot of doctors just don't comment on it because if they see the abdominal scan of 100 adults in the United States, 70 or 80 of them on average are going to have fatty liver. And so very often it'd be like commenting, oh, this patient has a pelvic bone and they have a lumbar spine. Well, yeah, it's so common. You're not going to say all that stuff in the radiology dictation report. And so very often they'll forget to comment on it. And so I caution patients when you ask for that scan of your liver, that you want the radiologist to comment either positively or negatively about both fatty liver and fatty pancreas. So they need to say in the dictation, this patient does have fatty streaking in the liver and or the pancreas, or this patient has no sign of fatty streaking in the liver and or in the pancreas. If it just doesn't mention it, then the doctor probably didn't think to mention it because it's so ubiquitous in modern society.
And you mentioned how common it is in adults, but it's also slightly common in children as well, which is staggering.
This is something that should not exist in modern society. There shouldn't be any child who's an alcoholic, right? There shouldn't be any child who's eating such a poor diet that it has caused metabolic associated fatty liver disease. But in fact, there is an epidemic of fatty liver disease in people under the age of 18 in the United States and in other developed countries. It's very sad. And what this is doing is setting these children up for a lifetime of suffering and chronic disease. And it's all completely reversible, completely curable if you catch it just at the fatty liver stage. If it's already progressed to non-alcoholic steatohepatitis, then it's harder. It takes longer to heal. If it's already progressed to cirrhosis, then that's in many cases permanent scarring of the liver tissue. You can improve, but you may never be able to reverse all that. But if any child, if they have an elevated A1C, if they have an elevated fasting insulin level, if they have elevated triglycerides, if they have high blood pressure, they absolutely need to be screened for fatty liver because they probably have it or they're in the early stages of developing it. And catching it early, it's completely reversible by making some simple, common sense changes to the child's diet.
Absolutely. We're going to talk about these common, simple changes that we can make. I want to talk about the connection towards disease because you mentioned some diseases there. But if somebody has fatty liver disease, that can progress to liver cancer and it is connected to other chronic diseases. Can you explain that?
Yeah, it's connected to multiple chronic diseases. It can lead to hepatitis. It can lead to cirrhosis or scarring of the liver. It can lead to liver failure. But what's less commonly known by most people and many doctors is that it can also lead indirectly to heart failure. If the liver is scarred enough, you can cause your heart to fail because it just can't pump the blood through the liver. So the liver is not a filter. That's not how it works. That's many doctors and dietitians will tell their patients that, oh, your liver's a filter. It filters your blood. That's absolutely false. Not true at all. It tags things in your blood that shouldn't be there. And then those things are filtered out by the kidneys or by other methods. But the liver is not a filter. It doesn't store toxins in it. None of that stuff is true. But what it can store in it is fat. And the way that you make your liver store fat in an unhealthy fashion is by eating too many carbohydrates. Definitely the simple carbohydrates are the quickest to give you fatty liver. So added sugar, drinking soft drinks. It's probably a combination of too much glucose and too much fructose. Fructose is the sugar we think of when we think of fruits or fruit juice. It's also very high in soft drinks. It's not metabolized the same way by your body as glucose is. And so a molecule of table sugar, sucrose, is actually one molecule of glucose and one molecule of fructose. Some fruit juices actually have more fructose in them than a can of Coca-Cola or a can of Pepsi. A lot of people don't understand that. They think fruit juice is a super healthy food to give their babies. Even the American Academy of Pediatrics says that before the age of 2, a child should not drink any fruit juice whatsoever. And from the age of 2 to 4, it's okay for them to have 2 ounces of fruit juice a day. Still not needed in any way, but it's okay. And then that goes up as the child gets older and therefore larger, that they can have 4 ounces, then 6 ounces. This is not a recommendation that your child should have 2, 4, or 6 ounces of fruit juice. It's saying that it's now okay that their liver's big enough that it can handle that fructose load. There is no need for fruit juice for children, even though it is health washed. Oh, I would never give my child Dr. Pepper or Mountain Dew. I'm a good parent. I would never do that. But then you turn right around and give them apple juice or orange juice, or grape juice. It's just as bad. In some cases, it's actually worse than giving your child a Coca-Cola. Parents don't know this. And so that's one of the reasons I do all I do, is to try to get the word out there that that's not okay. No child needs fruit juice ever. They also don't need Coca-Cola and Pepsi ever. Those things are not healthy. They're not good for your child. And so when we catch that fatty liver early in that child, we can make super simple changes that I'm sure you want to talk about to reverse that completely and reverse that child back to good metabolic health so that they don't suffer from heart failure, liver failure, kidney failure, and all the other things that can come from the very beginning. The first stage is fatty liver disease.
Absolutely. I think people need to understand, they can understand what is fatty liver, and we'll talk about exactly what that is and how that actually begins in detail. But I think people need to understand, what is the liver? Why should we care about the liver and the function of the liver? Because it is essential for life. Can you explain that?
The liver is so essential to human life and human health that it's one of the only organs in the human body that can regenerate. Almost no other organ in the body. We can heal and regrow a little bit, but the liver, you can do an operation on someone and take out 2/3 of their liver. And a year later, they'll have a full liver again. That's how important the liver is that we've evolved that ability to regenerate and regrow a liver just in case we're severely injured. The liver is not a filter, but it has hundreds and hundreds of jobs in the human body, many of which I would opine we haven't even invented yet. We haven't discovered yet. Back in the 30s, 40s, and 50s, when pharmaceuticals were becoming very popular, they were considered the mainstream high science, high technology solution to every medical problem. Medical researchers just stopped doing research into basic physiology and anatomy. So now many doctors just assume we know everything there is to know. I don't think that's true. I think in years to come, when we start doing this basic physiology research again, we'll find that the liver in human beings does things we didn't even know it did. Super important. But we have a list of hundreds of functions that the liver does. It tags toxins in the blood for them to be removed. It is in charge of glucose regulation. It's in charge of glucagon. It keeps all of the electrolytes very, very tightly balanced. It does so many things. And so just the average person listening to this, you just need to understand that the liver is super important. You want to keep it as healthy as you possibly can. That's really all you need to know about it, and that it's not a filter.
I want to talk about what is fatty liver disease. You spoke about why it is that dangerous and it's so common in our world. But if we understand what it is, what's actually happening inside the liver when somebody has fatty liver disease?
So when you eat too many carbohydrates, and a lot of people think, well, wait a minute, carbohydrates, that's bread and potatoes and beans. Yes, that's right. All those carbohydrates are made of sugar. And all fruits contain high amounts of sugar. When you turn that fruit into fruit juice, you actually increase the concentration of the sugar even more. And so we're built, we're omnivores. There's no doubt about that. We're able to handle some small amount of sugar in our diet, and it's not going to lead to much disease. But when you're eating too many carbohydrates, which break down into too much sugar, you overwhelm your liver's ability to cope with that. And one of the ways that it deals with that is, especially if you're drinking lots of fructose or eating too much fructose, it's going to store that sugar in the liver as fatty streaks, which can be seen on an ultrasound or a CAT scan or an MRI. When there's enough fat in these fatty streaks in your liver, then you're going to start having elevations in your ALT, your AST, and your GGT. These are basically the signal lights on your liver's dashboard saying, hey, you're doing something to me that's unhealthy. I don't like it. Please stop that. That's anytime those numbers are elevated, even if they're a little elevated, never let your doctor say, oh, it's just a little bit. It's probably nothing. We'll recheck it in 6 months. If any of your liver enzymes are elevated, that's a big problem. That needs to be thoroughly investigated, and an answer and a plan of remediation needs to be come up with before you leave that doctor's office. So when you put these fatty streaks down, it causes chronic inappropriate inflammation inside the liver. It causes the liver to not function as optimally as it could otherwise. It causes the blood flow through the liver to be hampered to some degree. That's why it can build up back pressure to the heart and lead to heart failure. It just causes a cascading disaster sequence to happen in your entire body because, as I said earlier, and all your listeners have remembered this, the liver is very, very important. You want your liver to be in optimal condition.
Can we completely fix our liver if it's damaged or has fatty liver?
If the damage you're talking about is fatty streaking, and there has been no hepatitis, which is inflammation of the liver, right? And there's been no scarring of the liver, which is cirrhosis, then yeah, you can completely reverse fatty liver back to normal. And so remember I said earlier, you can take out 2/3. I could go to Rena's house and duct tape her to a table and take out 2/3 of her liver. And if my technique was good enough, she didn't get sepsis and die. Within a year, Rena's liver would be back to full size. Okay. So we know that the liver can regenerate and regrow. And so what we're seeing in people, even with pretty advanced cirrhosis, is that when they cut the carbohydrate intake drastically, their liver doesn't go back to normal, but they are able to generate through stem cells new hepatocytes, which are the functional unit of the liver. And they're actually able to increase their liver function, in some cases, back up almost to normal, even though they had cirrhosis either caused by alcohol or from too much fructose or from some chemical injury. Because let's just say you took a Tylenol overdose when you were 18 because you just weren't in a good place. You did some significant damage to your liver, but you were in the ICU a few days. You got discharged. You're okay now, but your liver's been severely damaged. Well, now, if you're drinking fruit juice every day or Coca-Cola every day, you're impairing your liver's ability to heal because it's now having to cope with these new insults every day. Does that make sense? And so now, if you've got to leave your liver alone so that it can heal, you've got to stop assaulting it, stop insulting it, stop damaging it with the slow poison, which is a high sugar diet, whether that sugar is coming from added sugar or whether it's coming from fruit juice and eating lots of fruits and lots of honey. Honey is higher in fructose than almost any other food on planet Earth. So having a teaspoon of honey in your coffee occasionally, not a big deal. But if you're having, as I used to do, 2 or 3 tablespoons in every cup of coffee, that's too much fructose. That's going to lead to fatty streaking in your liver. So we've seen significant healing in the human liver when people adopt a low enough carbohydrate diet, strictly enough for long enough to give their liver time to heal and regenerate. We've seen liver function increase by 50%, 75% over what it was back when they were in their sick condition.
I had a question about, so if the liver can fix itself, is that also the same as the heart and the brain and any other organ in the body?
Well, the liver has an even greater ability to regenerate. And so if you have a heart attack, you're going to have some significant scarring in the heart muscle. Now, the heart does contain stem cells, but not nearly as many stem cells as the liver. Same goes for your kidneys, same goes for your brain. The brain is probably the least healing of the organs. So if you have a stroke, you're going to have some permanent neurological deficit. There's just not enough stem cells in the brain to lead to much healing, although you can have some. But the liver has a unique ability in the human body that it can regenerate just almost to a miraculous degree. When doctors first discovered this, people would be in a car accident or they would have a gunshot and they would have a huge bleeding artery in their liver and they'd have to take out 2/3 of their liver. Initially, they're like, well, this guy's, he's screwed. He's going to die, but we just had to save him temporarily. And so we had to remove 2/3 of his liver. And then he kept getting better and better and better. And they're like, wait, what's going on here? And then they would find out, oh my God, his liver's regrown. What the hell? And so, decades ago in medical practice, this was seen as like, we have no idea how this does this, how it happens. Now we have a better understanding, not a complete understanding by any means, but we do know that the liver has this unique ability over any other organ in the body to regenerate and regrow and to heal. But in order for that to happen, you have to stop slapping your liver around with high carbohydrate foods, with over-the-counter pain medication, and with alcohol. You have to stop all that foolishness and give your liver the room it needs and the time it needs to heal.
As Dr. Berry mentions, the number one way to fix fatty liver disease and other chronic health conditions is by following a low-carb diet, like keto or carnivore. And this is drastically going to improve your metabolic health. And with excellent metabolic health, you are less likely to end up in hospital. You are also less likely to need expensive health insurance because let's face it, when it comes to health insurance, we're paying for other people's chronic illness. And I'm sure that you want to put that money towards food and meat because we know that food is medicine. Well, that's why I have CrowdHealth as a sponsor of today's video. CrowdHealth is a revolutionary healthcare platform that empowers people like you and I by providing an alternative to traditional health insurance. Now, CrowdHealth, it's not an insurance company. It is a community-based funding healthcare platform. Now, what does that mean? Basically, you pay $50 per month to your crowd, for example, the carnivore crowd, and your health expenses like surgery, illness, pregnancy, doctor's visits are covered. And you'll also get personalized support through a personal care advocate. What I love about CrowdHealth is that it actually supports people like you and I that have great metabolic health. And that means lower costs for all of us. So if you're sick of paying insurance premiums, but you still want the healthcare and you still want the protection, just head to joincrowdhealth.com/carnivore and use code Primal Podcast to get 3 months for $99. Let's talk about some signs and symptoms that people can think, do they have fatty liver? Is their liver damaged? I have 11 here that we're going to go through. The first one is a dull abdominal pain in the upper right side or upper right shoulder pain. Why might that be a sign or a symptom?
Yeah, because as the liver forms these fatty streaks, the liver's going to enlarge and you'll start to have what's called hepatomegaly. Now, the liver itself doesn't have many nerve endings. And so I want to reemphasize again for everybody listening, the most common sign or symptom of having liver failure is having no signs or symptoms whatsoever. So don't wait until you have dull aching pain in your right upper part of your abdomen you've actually went too far down the road if you've gotten to that point. And so swelling of the liver or hepatomegaly, that can be a sign that you've got so much fatty streaking in your liver that now the liver's starting to enlarge in size. And a doctor who's really good at physical exam can detect this enlargement just under the right rib cage inferiorly. But very often they'll go ahead and order a scan anyway, and then it's confirmed on the CAT scan or the MRI that, yes, this person does have hepatomegaly, and there's lots of fatty streaking in the liver. So, yeah, that can be a symptom, but that's typically a symptom of a later stage of fatty liver.
Okay, maybe a symptom of earlier fatty liver is man boobs.
Well, and so this is an indirect symptom. Let's go over what increases your risk of having fatty liver. It's hyperglycemia from eating too many carbs. It's hyperinsulinemia from trying to deal with the hyperglycemia of eating too many carbs. That is going to lead to the improper deposition of fat on a man's body. He's going to get more of a female distribution, which means he's going to start having man boobs. So any guy listening to this, anybody listening, if you know somebody with man boobs, I've got a YouTube video about man boobs, okay? But I also have several about fatty liver. You need to watch those immediately and share those with that person. Because having man boobs, anybody who has true man boobs, not gynecomastia, there's actually an endocrinology condition that can cause swelling of the male breast tissue. That's not what we're talking about. We're talking about just inappropriate fat deposition in a female distribution. And I hope on your channel we can talk about men and women and males and females and everybody knows what I'm talking about. I think that's probably the case. And so if a man has boobs, they almost certainly have fatty liver disease.
What about women?
Yeah. And so women, if you're overweight or obese, if you're holding fat in any kind of a weird or unusual distribution on your body, you almost certainly have fatty liver. Now, you may have lipedema. You may have the kind of the apple shape versus the pear shape. Part of that's genetic. You may be holding fat in your belly like a man instead of more like a woman on your breasts and hips and thighs. You probably have fatty liver if that's going on.
Okay, next one is spider veins.
Yeah. And so remember I said that fatty liver can lead to heart failure, because it affects the distribution, the flow of blood all over your body. Now, the spider veins is probably multifactorial. There's probably a tiny genetic thing going on there. There's probably just chronic inappropriate inflammation. The veins are probably built of inferior materials because you're eating a high carb, low nutrient diet. And then when you've got this change in blood pressure coming to your legs and going back up to your heart, these improperly built capillaries or tiny venules, they're going to pop, and then you're going to have a spider vein. And so, yeah, indirectly, if you have lots of spider veins, you might have fatty liver.
Okay, next one is visceral fat, which doesn't mean that you have a big belly. Can you make that distinction, please?
So visceral fat is the most dangerous fat that a person can have. So visceral fat can include fat streaking in your pancreas, which in my opinion is the most dangerous kind of fat in your body. Next is fatty streaking in your liver, second most dangerous kind of fat in your body. And then you can also have fat inside your abdominal cavity. So this would be underneath your abdominal muscles. And some of you watching this may say, yeah, I don't have abdominal muscles. You do. They're just hidden right now. Okay. You've got them. They're in there. And so fat that's underneath that muscle wall is much more dangerous. Part of the way you store fat is genetic, but also part of it is just too many carbs, too much fructose, too much sugar. You're going to overload your body's capacity to deal with the sugar, and you're going to wind up storing fat inside your belly. And so for many people, having a big fatty stomach that just sticks out over your belt, that's not healthy, no doubt about it. But I would rather you have fat on the outside of your abdomen than on the inside of the abdominal cavity, underneath the abdominal muscles, because that's a much more unhealthy thing to have.
Which is called subcutaneous fat, when it's just healthy fat that we need to have versus the dangerous visceral fat. So the next one, swollen legs.
Yeah. So again, remember how fatty liver can cause heart disease and heart failure. That's because all the blood in your body flows through your liver every few minutes. Okay. And if your heart is having trouble pushing the blood through the liver because of fatty streaking, because of scar tissue, then that's going to change the blood pressure in other parts of your body. And the legs being the most dependent part, my legs, Rena's legs, maybe your legs watching this, they're the most dependent part of your body right now, meaning that they're lower down than the rest of you. Right. And so if you're having circulatory issues, you're going to leak some of the serum in your veins in your legs. It's going to leak out through the vein wall and into the interstitial space, and it's going to become edema. Okay. And the higher your blood sugar is, the higher your insulin level is, the more inflamed you are, the more edema you're likely to have. Now, there's a couple of medical conditions, lipedema and lymphedema, which can cause this to happen through other mechanisms as well. But many people have swelling in their legs, edema, and they don't have lipedema or lymphedema. We can actually see this in pregnant women in their second and third trimester because the condition of pregnancy makes a woman hyperinsulinemic. But that's okay. It's a temporary condition. That's what helps the baby grow. And so that can lead to, and many women, when they're pregnant, they'll be like, yeah, my legs swelled like crazy while I was pregnant. But as soon as I had the baby and got back to normal, my legs didn't swell anymore. That's exactly right. And that's okay when you're pregnant. But we've also found in pregnant women, if they're eating a low enough carbohydrate diet, they don't have nearly as much edema while they're pregnant. Okay. But that is a more normal thing to find in a pregnant woman, is that she has some pitting edema. But in a man or woman, if you've got edema in your lower legs, and the way you can test this is to just take the tip of your finger and push it against your shin and hold that for 10 seconds and then move it. If you left a dent there, like, oh yeah, I can see the impression where my finger was pushing against my shin bone, you have edema. And by how deep that dent is how a doctor would qualify your edema. Oh, they've got +1, +2, +3, or +4 pitting edema. If you have that, and you can do this test right now, you can do it while you're watching this video. If you leave a noticeable dent over your shin, you need to go see your doctor right now. You need to have your heart evaluated, because heart failure can cause fatty liver. You need to have your kidneys evaluated, because kidney failure can cause edema. Heart failure can cause edema, but also liver problems, fatty liver, non-alcoholic steatohepatitis, and cirrhosis can also cause edema in the legs. So those three things, the heart, the liver, and the kidneys, have to be thoroughly evaluated if you left a dent over your shin when you did my 10-second test.
Okay, next one is unusual skin changes or unexplained itching.
So remember earlier I said one of the main functions of the liver is to tag any toxins in your body for removal. And so when you're overworking your liver because you have fatty liver, you're drinking a gallon of orange juice a day, but it's fresh squeezed and organic, you think that's good for you, you're overwhelming your liver and it's not going to be able to do other jobs. And so you can have toxins build up in your bloodstream like ammonia and many other things that typically your liver would keep very tightly controlled. This can lead to itchy skin. You know, like, I don't know, I itch all the time. I don't know why. That can be a liver condition. Or you'll start to develop rashes. Or if you have enough edema in your legs for long enough, that can lead to skin breakdown. Your skin, you can start having rashes or even infections in your legs. Your legs can actually start to weep the serum that's leaking out of your veins. And so having liver disease can lead to very severe skin conditions as well.
Okay, so the next one is bad breath.
Yeah, now, so bad breath, typically, if you're eating a high enough sugar diet to lead to fatty liver, you're probably going to have cavities too. You're probably going to have smoldering abscesses in the roots of some of your teeth. You're going to have gum recession. You're also going to, because you're eating so much sugar, you're going to have a very unhealthy mouth microbiome. People don't realize, they've heard of the gut microbiome. They know that's a thing. But what you may not know is that you have billions of bacteria in your mouth. This can either be a good thing or it can be a bad thing. If you're eating a very low carbohydrate diet, then your mouth is going to be populated by bacteria that actually protect your oral health and protect the enamel of your teeth. But if you're eating too many carbohydrates on a daily basis, definitely if you're drinking too many carbohydrates, you're going to probably have bad breath. You're probably going to have cavities. You're going to have dental abscesses. You're going to have gum recession. All those things lead to horrible breath.
Okay, next one is night blindness.
Yeah, this can result from either the buildup of those toxins because your liver is not able to do its job of tagging toxins, or it can come from hyperglycemia chronically, which can damage the retina. Or it can come from, if you're just eating high carb junk food all the time, then you're not getting a good source of vitamin A or vitamin E in your diet, both of which your eyes need in order to have good night vision. You're not feeding your retina the food it needs. It doesn't need Doritos. It doesn't need Fruit Loops. That's not going to help your retina to see better at night. And so that's another multifactorial thing that indirectly leads right back to the liver.
Okay, last one is changes in bowel movements.
Yeah. So if you're eating a high carbohydrate diet, see how I keep going back to diet? It's like all this stuff is related to diet. It's weird, I know. But if you're eating a high carbohydrate diet, then what many people will do is they'll add fiber, artificial fiber, or they'll just eat high fiber foods thinking somehow that's going to help them. But in many people, especially people with ulcerative colitis or Crohn's disease or irritable bowel disease, the fiber can actually lead to irritation and inflammation in the colon and lead to chronic diarrhea. Or in some people, it leads to chronic constipation. If you're not eating enough healthy fat in your diet, that can lead to constipation. If you're not getting enough vitamins and minerals in your diet and enough fatty acids, that can lead to chronic constipation. So another indirect way that if you have chronic constipation, you probably need to be checked for fatty liver because you probably have it.
Okay, and then the last one is just generally you are insulin resistant or have elevated blood sugar, which I believe that you described with eating more carbohydrates. Are those previous signs and symptoms a symptom of insulin resistance and elevated blood sugar?
Yeah, and so hyperinsulinemia is the way I like to talk about insulin resistance because there's a test for insulin. You can get your fasting insulin checked. And if it's above 15, you have hyperinsulinemia. If it's above 10, you have early hyperinsulinemia. That's going to lead to a long life of chronic disease or a short life of miserable chronic disease. You want your fasting insulin level to be under 10. That's when you're really in the healthy zone. The closer to 5, the better. But chronic hyperglycemia, high blood sugar, chronic hyperinsulinemia, some people will talk about this and they'll call it insulin resistance. But there's really not a test that your doctor can check blood work or urine that says, look at your insulin resistance. That's a paradigm of thinking about metabolic disease, metabolic syndrome. But I really like for people to just get clear messages they can understand. And so you ask your doctor to check your A1C. You ask your doctor to check your fasting insulin. And if you're afraid that you have fatty liver, you ask for an AST, an ALT, and a GGT, and some kind of scan of your liver. That's the test you ask for. And then if your blood sugar's high, you have hyperglycemia. Boom, there you go. How do you fix that? Low carb diet. If your insulin level is above 15, you have hyperinsulinemia. There you go. There's your diagnosis. What do you do about that? Eat a lower carb diet. If you have fatty liver, your AST or ALT or GGT or all of them are high, and you get a scan, you have fatty streaking, you have fatty liver. You got it. You got your diagnosis. Now, what do you do about it? You eat a very, very low carbohydrate diet.
Okay, let's talk about the ranges for those metabolic tests. So GGT, ALT. Was it ALT or AST?
AST and ALT. They check slightly different function of the liver. And so that's going to give you more of a global look if you check all three of those markers.
Okay. Are there any ranges that people can look at? Because I know that typically standard ranges on a blood test is very different to what is optimal. So can you provide some optimal ranges?
Yeah. And so if you're trying to figure out, do I have fatty liver or not, then you can go by the normal ranges. As long as you're within the normal range, then you don't have any fatty liver to worry about. You may still have some early fatty streaking, which only a CAT scan or an MRI would detect, but it's not enough fatty streaking that it's causing your AST, ALT, or GGT to elevate. So you're in pretty good shape. You may not be perfect. And so you really want the AST, ALT, and GGT to be in the lower range of what your reference lab would call the normal range. You want it to be towards the lower ends.
And also with fasting insulin, is there optimal ranges for that one?
Yeah. So I think ideal is 5 or lower, keeping in mind that if your fasting insulin is 0 or very close to 0, then you have type 1 diabetes. So we don't want it, and you're not going to cause yourself to have that. You either have that or you don't. But if you get your fasting insulin checked, and let's say it's 35, now your doctor may not know what to do with that. They may be like, well, I don't know it. The lab sheets usually say that anything under 25 is normal. And so let's just say yours comes back 24.5 and your doc's like, oh, okay, I don't know why you wanted to check that. It's normal. That's not normal. That's hyperinsulinemia. So that's too high. That's going to cause bad problems for you in the future. The way you fix it is to eat a very, very low carbohydrate diet and get the fasting insulin rechecked every 3 to 6 months and keep cutting the carbs until you get your fasting insulin at least down to 10, if not a little bit lower. Then you know that you have reversed your hyperinsulinemia. But many doctors, and be prepared for this, you guys watching, many doctors have never checked a fasting insulin in their whole career of 10, 20, 30 years. They don't know what it is. They don't know what it means. And so anytime a doctor doesn't know what a test means, they don't understand what it implies, they don't know what to do about it, they're not going to check it. So you'll meet resistance when you ask for that test. And so that's why Kim Howerton and I wrote the book Common Sense Labs, is to give people a guide to say, hey, here's why your insulin level is important. Here's how to ask for it. Also, here's the CPT code in case your doctor says, well, I don't even know what that is. And be like, well, here's the CPT code in the United States. And in many countries, that's the actual order code that you can order that test with. And so if your country uses the ICD-10 codes and the CPT codes, even if they don't speak English, you can still say, here's the CPT code. I want you to order this test. And then if the doctor refuses, then you either find a new doctor or you find some online service that'll check the fasting insulin.
I think that people can go to online services where they can submit their own labs. So if they know that IC10 code, then what is the IC10 code, by the way, for fasting insulin in the US?
I don't have it memorized. It's the CPT code, which would be, yeah, CPT. And so ICD-10 is the current, how we diagnose. Every diagnosis from hypertension to fatty liver, it's got a specific number that's associated with it. And for years, we used the ICD-9. Now they've updated it and we use the ICD-10. It's super complicated. Nobody listening needs to remember those abbreviations. Just remember what's the CPT code, and I'll actually send it to you, Rena, so you can put it in the show notes. And it's just the CPT code, and it's a 5-digit code. And you tell your doctor, I want you to order that test.
Okay, let's talk about solutions. What do you think about these superfoods? Because everywhere on YouTube, when I was looking at how to fix fatty liver disease, cleansers, juices, I know your opinion on this, but please explain.
It's so dumb. It's so dumb, Rena. So this is part of our overarching paradigm in Western society. That's where this comes from. Anytime we have a problem that we want to solve, what's our first thought? I need to add something. I need to buy something. I need to acquire something to fix this problem. That's how we've been trained our entire life. If you have a problem, then there's a solution, but it's going to cost you. You're going to have to pay for it. You're going to have to buy something. You're going to have to add something to the system. In this case, fatty liver is the way you reverse it is by removing things, by subtracting things. There is no liver cleanse that's going to fix your fatty liver. And indeed, many of the liver cleanses out there will make your fatty liver worse. So if they're like, oh, you need to do this juice cleanse, 30-day juice cleanse, and that's going to fix your fatty liver. No, I can guarantee you that's going to make your fatty liver worse. If you drink fruit juice for 30 days, your fatty liver will worsen. It will not improve. Here's a detox, here's a this, here's a that, here's some supplements. Here, this root grows in the deepest, darkest Asian jungle, and you have to trek 3 days in to harvest this root. And that's complete and utter bullshit. Okay. There is no root. There is no cleanse. There is no juice. There is no anything. You fix fatty liver by fasting. You can do it that way, absolutely. Or by just continuing to eat, but cutting your carbohydrate intake drastically. You remove things from your diet. And so if somebody wanted to reverse it really quickly, they could just do a 3, 5, 7 day water only fast. And for most people, a 7-day fast will completely reverse their fatty liver.
Okay, I want to talk about fat. The saturated fat, because if you think about fat in the liver, many people might think, oh my God, saturated fat is going to affect the liver. Is there any correlation?
No. So, but again, you understand why so many people misunderstand this, because fat rhymes with fat. It's the same exact word. And so you're like, well, I've got fat in my liver, so it seems foolish to eat more fat. Seems like that would make it worse because fat is fat. They rhyme. That's not how it works at all. Fatty liver is caused by too much sugar in your diet too consistently for too long. It can also be caused by alcohol. It can also be caused by taking over-the-counter pain drug relievers for too often for too long. Any of those things can cause fatty liver. So the way you fix fatty liver is to remove those things from your diet and from your lifestyle. Eating a low-fat diet is one of the things that can cause fatty liver. Because if you remove all the fat from your diet, you have to eat something. And so you've only got 3 macronutrients. You've got fat, you got carbohydrates, and you got protein. So if you remove all the fat, well, you only got fat, protein, and carbohydrates. You're going to have to eat more carbohydrates by definition. That's a higher carb diet. That's going to make fatty liver worse. Most people, the way they reverse this, because most people don't want to do a 7-day fast, and I don't blame them. I don't like fasting either. I've done a 2-day fast, and it was not fun. I don't enjoy it. So if you don't want to fast, then you keep eating, but you just cut the carbohydrate intake drastically from all food sources. The very first thing you get rid of is anything that has added sugar, because that's by definition junk food. Stop all of that immediately. And then stop all of the foods that naturally have sugar, including fruit juice is the number one offender. And a lot of people say, oh, no, that you don't understand. This is 100% organic fruit juice. This is not sugar added. I don't care. Adding sugar to fruit juice is like adding TNT to nitroglycerin. Okay? It's nitroglycerin to start with. And so fruit juice is just liquid sugar to start with. So definitely you don't want added sugar fruit juice, but you don't want fruit juice either if you're trying to reverse fatty liver.
Okay, what about things like bacon and butter? So if you eat more of that, is that going to help with fatty liver?
So there's nothing magical in the butter or the bacon that's going to reverse fatty liver. But when you eat bacon, that means you're not eating something else. When you eat butter, that means you're not eating something else, because the fat and the protein in bacon and the fat in butter are very satiating. So you're not going to be as hungry. You're going to be full for longer. And it's going to also, if you're a sugar addict, which many people are, it's going to help with the cravings to be full, right? And so if you buy a bacon that doesn't have a bunch of sugar piled on top, it's just fat and protein. Okay, there's nothing dangerous or bad about bacon. Bacon is a health food. So if you stop eating the honey buns and the Doritos and you stop drinking the orange juice and you start eating more bacon and butter, you're going to reverse your fatty liver. And it's not because of any magical thing in the bacon or butter. It's because you stopped eating the other stuff. You have to remove things to reverse fatty liver, not add.
Okay, let's talk about eggs and choline benefit in eggs. How does that help the liver?
Yeah, so choline is eggs are rich in it. It's very good for many different organs in your body. Your liver requires a good source of choline. If you don't have enough choline in your diet, then your liver function is going to suffer because of that. Again, eggs are 99% fat and protein, very, very low in carbohydrate. The average large egg has 1 gram of carbohydrate, mainly in the form of glycogen. It's not sugar. And so for most people, that's so low in carbs, you don't even have to count it, right? So when you're eating eggs that are rich in choline, but also many, many other vitamins and minerals, it's a superfood to help your liver heal because of the choline and because of many other things in the egg. And again, when you're eating eggs, you're not eating something else. And that removal of what you're not eating, that's what's going to not only reverse fatty liver, but keep it from forming in the first place.
So there is something called a superfood, eggs.
Yeah. Eggs and liver, I'm sorry, but they are actually superfoods. If your definition of a superfood is something that humans have eaten for hundreds of thousands of years, something that's very nutrient dense, something that's uninflammatory, something that your body knows exactly what to do with it, and actually it helps your body heal, then eggs are a superfood. Absolutely.
Okay, I want to ask you about turmeric. Does turmeric in any way heal the liver?
So most turmeric is not even absorbed by the human intestine. You have to get a very specific kind for it to even be absorbed into your bloodstream. 99% of turmeric is you poop it out. You don't even absorb it. So obviously that can't be helping your liver if it doesn't get into your blood circulation. If you do buy the very, very expensive extracts of turmeric that can get into the circulation, they might help a little. This is a false solution. This is what I call a 1% solution. So if our watchers like, well, I love Pepsi and Doritos, I'm going to keep eating that, but I'm just going to buy this super expensive turmeric, and that's going to help my fatty liver. Well, it might improve it 1%, but it's never going to completely reverse your fatty liver. If you want to reverse your fatty liver, then you're going to focus on 80% solutions. And the 80% solution is to cut the carbohydrate intake in your diet drastically, daily, consistently for the long term. And then you don't have to waste your money on the expensive turmeric. You can just buy more meat and eggs and butter. And there you go. You've got a proper human diet. You reversed your fatty liver, and you didn't waste money on some foolish cleanse or detox or turmeric that's not going to help you anyway.
Absolutely. I love your straightforward, no BS approach. Very, very clear and simple. That's the 80% solution. Let's just talk about the 20%. Because it's interesting, vitamin D is associated or a slight connection with fatty liver.
Yep. So choline is a small solution. Vitamin D is a small solution. Lifestyle is a small solution. If you lay on the couch 24/7, you're not active like a human being should be, that's going to tend to make you more likely to have fatty liver. It's not going to cause it, but it can stack up. Also, all these little 1% and 2% things can stack up in the setting of eating a high carbohydrate diet, and you can get fatty liver quicker by doing these other things. And so a proper human lifestyle is very important, making sure you get enough of all the essential vitamins and minerals, the essential fatty acids and amino acids. That's very, very important. But it all comes down to eating too many carbs too consistently for too long.
Okay. And what about glucophage or metformin, typically to help lower blood sugar? Does that help in any way with fatty liver?
Yeah, it actually does. And again, this is a 1% or 2% solution. You can't keep eating the crap diet and say, oh, I'm going to take metformin or glucophage or berberine, and that's going to fix it. It may slightly improve it, but it very rarely do I see somebody taking metformin or glucophage and that completely repairs their fatty liver unless they change their diet as well. And so many people spend so much time and money and effort and willpower on all these 1% and 2% solutions. But and I think the majority of people, it's just because they don't understand the power of a very low carbohydrate diet. They think, well, diet doesn't matter. I'm going to buy this turmeric. I'm going to buy this glucophage. I'm going to do this juice cleanse, and that's going to fix it. That's never going to fix it. In some cases, it might make it worse. The way you fix it and keep it fixed is by adopting and sticking to a very low carbohydrate diet for the long term.
Absolutely. I think that you would have the most experience because didn't you have early signs of fatty liver disease before you became the most healthiest doctor in the world?
Yeah, we called it morbid obesity back then. We've changed the term because that sounds judgmental. Now we call it severe obesity. I had severe obesity, prediabetes, blood pressure was creeping up, and my AST was already starting to elevate. So I had multiple risk factors and signs of fatty liver. Now, doctors make the worst patients in the world. And so I've never had an abdominal CAT scan in my life. And so I just didn't take the time to get the ultrasound or the CAT scan to verify it. But almost certainly I had fatty liver back before I went on this journey to discover what is a proper human diet. Now, Nisha and I checked our labs a few months back, and every single liver marker is stone cold normal. Whereas back in the day when I was eating the American Diabetes Association recommended diet. I was following their handout. and my AST was a little bit elevated. I was also drinking alcohol a little bit back then. Never had an alcohol problem. I just liked it. And so I was drinking alcohol way more regularly than I should have been. And I was just eating junk. Even though I was eating organic whole grain bread, that's still junk too. And so many people don't realize that. And so for some people, a sweet potato, that's fine. For some people, eating, a huge bowl of grapes is fine. But for some people, that's too many carbohydrates. That's too much sugar, too much fructose. It's going to lead to fatty liver, or it's going to make fatty liver worse.
Some people, they don't know the basic foods. Well, it's not so much basic because we're told that, whole grains and sourdough bread is so healthy for you. They might also not know that certain medications can affect their health and also contribute towards fatty liver. I really want to understand three main medications. First of all is Tylenol. What is Tylenol and what is it used for, and how does it contribute towards destroying your liver?
Yeah, so acetaminophen, the brand name is Tylenol, and there's paracetamol. There's several different names around the world, but it's very hard on your liver. Your liver has to work extra hard to tag the acetaminophen and to have it removed from your system. And if you take Tylenol consistently multiple times a day, every day, for chronic headaches, it doesn't matter what you're taking it for. Your liver has to do all the work to tag it and have it removed. That's going to lead to liver damage in the long term. And then if somebody is not in a good place and they take an overdose of Tylenol, that can kill you or worse. And so people do commit suicide that way, but also some people attempt suicide and they wind up with chronic liver failure, which is a terrible, terrible life. Their life winds up much worse than it was before the suicide attempt, because now they have liver failure and they have to contend with everything that brings. So I recommend everybody, also acetaminophen in all of its names, but also ibuprofen and naproxen. If you take these consistently multiple times a day, every day, for your knee, your ankle, your headache, your whatever, backache, that is very hard on your liver. And after months and months and years of that, you're going to have liver damage. And that can show up as fatty liver, but it can show up as hepatitis or cirrhosis. You don't want that. And so only take any pain reliever when you have moderate or severe pain. Never just take an over-the-counter pain reliever if you just have a little mild headache or a mild little ache here or there. Don't take anything for that, because you're making your liver have to work double time when you do that.
What about statins? That is something that is prescribed so often. We know the links, well, some people, they know the links of statins and dementia. How do statins affect the liver?
Yeah, so statins are very hard on the liver. And 2 decades ago, when I was prescribing statins for most of my patients, it was actually in the guidelines that you need to check liver function tests the first few times after they start a statin, because it was just a known thing that in 5% of people, their liver markers are going to elevate from the statin. Most doctors, especially young doctors, don't know that now. They think statins are completely fine and safe. They think that statins should be over the counter. They're so safe. That's not true. Anybody who's taking a statin needs to have a routine check on their liver labs, because it can make your liver have to work too hard.
Absolutely. The last thing I want to talk about is just the stages of fatty liver, because there are 4 kind of stages. Could you just outline that? And how long does it take to progress to stage 4, which is end stage liver disease, which could end up in death or a liver transplant?
Yeah, it depends on what caused your liver disease. If it's just because you chronically, you eat bread several times a day, you drink a Coke or 2 a day, you drink a big glass of orange juice every morning, you eat, you're just eating all the carbs and drinking all the sugar, then it can take many months or several years to develop the first fatty streaking that would be visible on a abdominal scan. And then several more months or years before you start to elevate your AST, your ALT, and your GGT. So you're years down the road when those things start to show up. Years of damage has been done, a small amount of which cannot be taken back. You can reverse most of it, but maybe not all of it. And that's why I really encourage people to get your liver checked early and get it checked often if you do have fatty liver, so that you can rest assured that you reverse that. It can take years before you develop end-stage liver disease just from metabolic associated fatty liver. But why take a chance? Why go down that road for so many years? Why not stop insulting your liver? Stop slowly poisoning your liver with all the sugar and all the carbs. Why not stop it now and reverse it? Then you don't have to worry about it.
Absolutely. I think people have a very good idea about how to fix fatty liver, and the simple solution: stop the carbs, eat more fat, eat more fatty red meat, eat more bacon. Dr. Berry, thank you so much for being here. This has been, I think I've learned more from you than a lifetime of what I could ever learn elsewhere. So thank you so much. If people want to find you, I'm sure they can find you. But if somebody doesn't know where you are, where can they find you?
So I've got a small YouTube channel that you can find me there. Just type in Dr. Berry Fatty Liver, and you can find my videos about that. If I'm feeling snarky, you'll find me on Twitter. If I'm feeling gentle and loving, you'll find me on Facebook or Instagram. I've got accounts all those places. And then also, for the few Bitcoin lovers out there, I'm also on Nostr. And if you don't know what Nostr is, that's fine. Don't worry about it. You'll hear about it later. But if you do know what it is, I'll see you on Nostr.
Wonderful. Thank you, Dr. Berry. And I'm sure we're going to see you very soon.
Thank you. Thank you.
Thank you for joining me on this episode with Dr. Ken Berry. You can find further explanations about fatty liver disease and also the test for fasting insulin and the code that you'll need at the Primal Labs. There is a link in the description of this episode. You can just click that. It's going to open up and you'll see lots of information about fatty liver disease, how to fix it, and that code. Now, if you're learning from and enjoying these episodes, please hit the subscribe button, as that is an excellent zero-cost way to support this free health podcast. Now, you can also find me on other social media. I'm on Instagram and on Twitter at the Primal Podcast, where I generally share different information to what you'll see here on YouTube. I share health tips and advice that I hear from the best experts. Now, if you like this episode with Dr. Ken Berry, you'll also love another episode I did with Dr. Georgia Eid about the brain. Dr. Eid is a Harvard-trained psychiatrist, and she'll talk about how you can fix brain disease like dementia and Alzheimer's, but also mental health conditions like dementia and depression through nutrition. She'll talk about why fat is so important, the foods that you need to avoid that I'm sure you're eating every day, and what to eat instead to fix your brain. Finally, thank you for your interest in root cause healing, and I'll see you next week.